Hello, everyone. Thank you all for coming here. My name is Vera Turlings, and next to me I have Noah Olmeijer. We will today walk you through the entire event and do the opening and the closing and everything in between. It's very fun to be here actually because both of us have been chairs of the SensUs organization in previous editions. So it's very exciting to be here again.
Yeah, it's great to see such a big room filled with all interesting people and teams. And there are a lot of teams that are new, and I'm super excited for that as well. And in this 2024 edition, it's also a little bit different because we're focusing on continuous monitoring. And that's also very dear to me. SensUs in general is very dear to me. As you might know, I'm a biomedical engineering student myself, and I specifically study or specialize in molecular biosensing in my master's degree. And for a lot of you who might also know that, is that biosensing can be a little bit abstract in the beginning, and it's hard to tie the theory to the practice. But SensUs is really where you can do that, and that's very great. And I would really like to see all of your great designs and pitches today. So I'm very excited for that.
Yeah, and also not only the biosensor aspect, but also very much working in teams. You really should not underestimate all the work you have all put into this for the past year and all the things that you have learned. And I'm very confident that even after your SensUs year, you will still enjoy everything that you have learned in the entire year. Just like I also experienced myself after doing SensUs. So, yeah. That's for that.
Try to enjoy yourself a bit today. I know it's been a chaotic week and even a more chaotic year. But today is finally, the event will come to a closing, and try to enjoy it a bit. And I'm very excited to see who the winner is of all these prizes that you can win. So without further ado, I will introduce to you the chair of the SensUs 2024 organization, Oshra Gronskite.
Hello everyone, my name is Oshra. I'm the chair of SensUs 2024. On behalf of the entire group, I wanted to welcome you to the final event of SensUs 2024. After the whole year of preparations, we are happy to see so many people here. Thank you for coming, students, partners, professors, jury members, families and friends. Thank you, dear participants, for working so much in the past few months and coming all the way here to Eindhoven. Give yourselves a round of applause, because you deserve it. As you might know, the students in SensUs focus on creating innovative biosensors for socially impactful diseases. The teams are formed in a multidisciplinary way, since these kind of problems are not solved by doing it alone and require intense teamwork. The teams are challenged to build a working prototype and to also think how the prototype could come into the market. Since the students are able to think freely and in creative ways, they can come up with new, innovative ideas for biosensing. To make sure all of this becomes possible, the SensUs organization has worked the entire year. The team of 13 highly motivated students, we've managed to create a wonderful event that we are proud to share with you all. We hope that you're enjoying it as much as we do. Throughout the years, we've explored a lot of different disease topics. This year, we repeated the topic from the very first SensUs edition in 2016, kidney failure. However, there is a challenging difference. This year, as mentioned previously, it is with continuous monitoring. Kidney failure and acute kidney injury are characterized by one or both kidneys losing their function, or to put it more simply, they lose their ability to filter waste matter from the blood. This results in an accumulation of waste in the bloodstream. Millions of people around the world are affected by this disease, and sometimes reacting fast is absolutely necessary. Creatinine is the key waste molecule that is found in blood and is removed by the kidneys if they're functioning well. However, if kidney function is impaired, there is accumulation of creatinine in the blood, and the patient gets into a very risky condition. This is why it is important to find a suitable and convenient way to monitor kidney function by continuously measuring the levels of creatinine and other waste molecules. And this is what the teams have been working on this year. I must mention our partners too. Only with their help we are able to organize the competition and to give this opportunity to the teams. Also, they were helping the teams to improve their biosensors by providing feedback and sharing their knowledge. Huge thanks to all of them. Now, the most important part. Do not forget to enjoy today. No matter the final result, you've worked a lot and you've learned a lot, and this is what we all aim for. Go, chat with other participants, or have discussions with jury members or partners. Visitors, please enjoy the pitches of the teams, either here in person or online, and vote for the 2 teams that you liked the most. I'm going towards the end of my part, so now let's have a quick peek into how the biosensor testing event on Tuesday went. Thank you all for being here, and see you around.
Looks quite impressive, doesn't it? Very impressive. Thank you, Aushra, for the nice overview of SensUs and what it's all about. But what it's also about is these nice prizes that you can win over there. And the prizes consist, of course, of the Analytical Performance Award, the Innovation Award, the Translation Potential Award, and the Public Inspiration Award. And we will give you a nice overview of all these awards and what they are about. So, the first award, and also the award for the best biosensor and their analytical performance used this year, is the Analytical Performance Award. And what this award is about is creating the best biosensor technologically. And it's about having a biosensor that is fast, it has to be accurate, you have to use a small sample volume, and much more. And this all is used as a metric for in the algorithm. It's a quantitative algorithm developed by the technology department of SensUs. So we try to be as much as quantitative as possible in determining the winner of this award. And I hope it will be very interesting to see who the winner is.
Yeah, next is the Innovation Award. This winner will be determined by a jury, because even though not all biosensors perform well during the testing event for various reasons, even traveling sometimes with the sensors, we still want to give the teams the opportunity to present how their biosensor uses very innovative ways of sensing the molecule. So for that reason, we will later in the day also have pitches by the teams who will present their idea, and these pitches will be judged by the jury. The jury chair is Michael Daniel, and the vice chair will be Sven Ingebrand. And next, for the Translation Potential Award, it will also be based on pitches and a jury to really see which biosensor has the most potential to be translated into the clinic or the market. So it's more business focused, and how to actually make the step into, for example, the hospitals or patients' homes. And this year the chair will be Annelies Bobbelin with vice chair Angela Bikker.
All right, so another award is the Public Inspiration Award, and also the general public who are here today and also online can cast their vote to their favorite team. So try to look at the pitches today and see which pitch you think is the best, or which team deserves your vote. And you can vote using the QR code online. And next up, there will be the 1-minute pitches. So try to look at these pitches and determine which pitch in real life you would want to see. All right, so let's
enjoy.
Start this video.
Hi everyone, we're Ryan Alex and very excited to develop a biosensor for continuous creative monitoring. After lots of hard work, we're finally able to order all the materials you need. So now, we just have to wait. Bad news, guys. The shipping date has now been pushed to July.
But the college is closed in August. But we don't have time. We just have to give up.
We have some great feedback from doctors and medical professionals. And our idea is gold. Literally gold.
Guys, I think we can start now.
1 month. Impossible.
It's possible. It's possible.
Introducing AptaSense, an aptamer-based electrochemical biosensor whose microfluidics and user-friendly interface allows the monitoring of kidney failure. Want to know more? Join us on our project presentation.
Hi, we're SensNC, and welcome to the Sounds of Sensing. For those with kidney failure, creatinine levels may fluctuate because of the kidney's inability to filter it out. Renal tests are expensive, so we designed Q-Test, a continuous biosensor that uses copper to find the concentration of creatinine. Using copper as a non-biological recognition element makes the production of our sensor easier and more cost-efficient. Our custom electronics include a potentiostat and a main board designed specifically to interact with our sensor. Q-Test is a way to take control of your health, to be able to real-time monitor the status of your well-being, and to hold it in the palm of your hand. Thanks for listening to the Sounds of Sensing.
We're Lillian Sporthy from Cornell Science Tech. Chronic kidney disease is often diagnosed too late, with almost 90% of adults not knowing they have it, placing a financial burden on the healthcare system due to the costly nature of dialysis and transplant procedures.
This year, our team focused on developing a biosensor that puts our patients' health into their own hands before it's too late. To do this, we've developed an original optical biosensor that uses oblique incidence reflectivity difference, or OIRD, Creatinine-specific aptamers are bound to glass through a silane PEG NHS linker, and interstitial fluid is pumped through the flow cell. A laser is pointed on the cell, and the reflectivity difference from incident light is converted into an output on our Creat Connect app, where the patient can read their results in real time.
Through OIRD, we are able to develop a unique label-free detection method that we hope to translate into a compatible diagnosis tool that bridges patients and healthcare providers.
In China, 120 million people suffer from CKD, but due to the lack of obvious symptoms in the early stage, such as urine decreases, the rate of misdiagnosis of CKD is high. However, missing the optimal time for diagnosis and treatment can be very harmful, significantly increasing the risk of cardiovascular events and deaths. In addition, like weight, the indicators of the human body fluctuate from day to day, so a single test does not give a true picture of the health status. To this end, our team, TrueSense, is committed to developing a biosensor for continuous monitoring, which consists of a painless microneedle patch for in situ detection and an electrochemical workstation with very small size, which can realize wearable portable testing, greatly reducing the time and economic cost of patient testing. Want to learn more? Follow TrueSense in action.
The 2024 brings worldwide challenges. Statistics show a concerning rise in kidney disease cases. Kidneys are vital organs for filtering waste from blood, regulating fluid balance, and maintaining overall health. When they fail, the consequences can be severe. Understanding the trends of creatinine can help doctors diagnose and mitigate the impact of kidney-related diseases on human body. Here in UC Team, we are doing our best to tackle this challenge, making way for personalized medicine. Through modern research and innovation, we are working to deliver a wearable creatinine biosensor that will help you stay on top of your health.
Hi, SensUs here. Quick question. Did you know that over 1.7 million people in the Netherlands alone are at risk of kidney dysfunction, often without even knowing it? With causes ranging from diabetes, hypertension to everyday medications. The risk of undetected renal dysfunction is alarmingly high. That is why SensUs developed a proof-of-concept biosensor which monitors creatinine levels continuously. Our low-waste and compact biosensor uses electrochemistry in combination with a creatinine-specific enzyme for fast and accurate detection. This technology provides real-time insights of a patient's kidney health with just a single drop. With our sensor, you can catch early warnings and monitor kidney health proactively. Spark your interest? Come and meet us. SensUs, monitoring kidney health one drop at a time.
Did you know that nearly 40% of terminal renal failure patients could have gained up to 4 more years of life had they been diagnosed sooner?
So how can we act? The solution lies not just in monitoring creatinine levels, but in understanding how these levels vary over time. That's where we, AgroSense, comes in. Our goal isn't just to provide a biosensor, it's to create a platform that delivers unprecedented data to researchers. This will enhance our understanding of the disease and enable early interventions.
Our final product will be capable of detecting different metabolites, revealing how they fluctuate together and opening new avenues for early detection.
Our biosensor is designed for accuracy, efficiency, and ease of use. Utilizing advanced microfluidic technology and minimal materials, it is both affordable and accessible. Whether it is on a top hospital or remote medical desert, our device can be used by anyone, anywhere.
We envision a future where blood tests are quick, on-the-spot procedures during any doctor visit, revolutionizing the way we treat renal failures.
Imagine living with kidney disease, constantly worrying about your kidney health and the risk of failure. Monitoring your kidney health is a tedious task that requires a phlebotomist and a trip to the hospital. Now picture a device that fits in your backpack, allowing you to take measurements on the go. Our team at DTU has developed exactly that, a cutting-edge biosensor that uses quartz crystal microbalance technology to continuously measure creatinine levels by detecting mass changes through shifts in the resonant frequency. A microcontroller converts this into quantitative results using a calibration curve and then sends this data directly to you. Designed for ease of use, our device connects seamlessly to your smartphone or your laptop, allowing you and your healthcare provider to track your kidney health anytime, anywhere. With our biosensor, we're not just offering a tool, we're providing a lifeline for those with kidney conditions, helping them live healthier, more confident lives.
This is the day we've been looking forward for the past 6 months. Every once in a while, a revolutionary product comes along that changes everything. At Xsense, we have the privilege of working on some of the most groundbreaking innovation to date. Today, we're introducing you 3 revolutionary products. A biosensor that continuously monitors creatinine, an IoT device with a seamless app interface, and a next-generation wearable. 3 things. A biosensor to continuously monitor creatinine, an IoT devices, and a next-generation wearable. A biosensor, an IoT devices, a wearable. Are you getting it? Those are not 3 separated devices. This is one device. And we're calling it Acura.
Acute kidney injury is a major public health concern that significantly degrades patients' quality of life. Kidney function should be closely monitored, which could be done by sensing creatinine levels. CreaTrack is a novel, accurate, highly sensitive and user-friendly continuous creatinine sensor. Our prototype consists of a fluidic sensing chamber operated by a pump enclosed within a compact package. The sensor uses an enzyme that binds to creatinine. This interaction is transduced into an electrochemical signal. CreaTrack is connected via Bluetooth to CreaView, an app where you can visualize your creatinine levels and have insight into kidney health. CreaTrack is an end-to-end solution for chronic kidney disease patients and post-organ transplant patients. Come to our creativity and translation potential pitches to find out more.
Acute kidney injury, or AKI, is rapid loss of kidney function, caused by a kidney straining event or disease, such as surgery or heart failure. AKI-related hospitalizations are rising and contribute to overloaded hospitals and emergency rooms. This is where SensUs comes into play. Our biosensor harnesses the power of electrochemical detection. SensUs uses an aptamer, a simple DNA strand that captures and releases creatinine, allowing continuous detection, rapid measurement, all in one user-friendly device. Continuous monitoring after heart surgeries will allow hospitals to care for more patients, doctors to make rapid decisions based on real-time data, and provide patients with better outcomes and more freedom. Grounded in science, propelled through innovation, biosensing.
Hello there, I'm Gogo, and today I'm taking you on a behind-the-scenes journey with my incredible team as we work on our sensor. Buckle up! Starting strong with our business team, clicking buttons and acting like they know what they're doing. But hey, keep going. Oh, and here comes the biotech genius, mixing things that definitely shouldn't be mixed. And here are the social butterflies, sipping on nothing. Invisible lattes, anyone? Now here's our 3D printer being calibrated with nothing actually being printed. Maybe one day it'll spring into action. And that, my dear friends, is just a glimpse into our epic Sensus 24 journey. A journey filled with fun potlucks, questionable decisions, slightly dangerous science experiments, and imaginary coffee breaks. But hey, it wouldn't be us without a little chaos, right?
Every year, millions of lives are affected by acute kidney injury. It's fast, unpredictable, and often deadly. But what if we could detect it earlier? Introducing our ToucanSense biosensor, a cutting-edge solution for real-time kidney health monitoring. Our biosensor features a DNA aptamer for creatinine detection, a gold-coated electrode, and EIS for precise real-time data. Its self-regenerating design resets after each measurement, ensuring continuous recalibration pre-operation. Integrated with a microfluidic system, it controls sample flow and measurement conditions. This design is an essential tool for both patients and healthcare providers. Our biosensor makes early detection of acute kidney injury a reality. Embrace the future of kidney health with our cutting-edge technology.
Hey, what's going on? It's Alexi here with our wearable biosensor. Cardiovascular disease and chronic kidney disease are two deadly conditions that are deeply interconnected. Did you know that 90% of kidney disease patients die from heart disease? On the other hand, heart disease treatments can further harm kidneys, trapping patients in a vicious cycle. We are breaking that cycle with NeutroPal, a wearable biosensor that continuously monitors key indicators of kidney health. Our device uses cutting-edge ion-sensitive field effect transistor technology to provide real-time data to a smartphone app, empowering patients and physicians to monitor their health. NeutroPal targets heart disease patients on meds like ACE inhibitors, which are harmful for kidneys. Our goal is to prevent chronic kidney disease and tap into $20 billion US market with 9 million patients. Imagine a future where heart and kidney diseases are caught before they spiral out of control. That's the reality NeutroPal is creating. Thank you so much for watching.
We are the Secretum team. We conquer the peaks of science. We dive deeper into our research. Let's go see the biosensor we've created.
Wow! Oh, look, what is that?
Well, this is the aptamer, and I guess he has a friend.
And I would bet my brain on that it is an enantiomer.
Let's see how they might work together.
And they seem starving. I will try to feed them.
Oh, shoot! I'll fix it.
Yikes! They've had enough.
Let's go tell the others.
Hi, I'm Danny from TU Eindhoven Sensing Team, or as we like to call ourselves, TEST. We're developing a biosensor which can continuously measure creatinine. On a microscopic level, our sensor represents a light switch. This is the default state, where creatinine is absent and light is emitted. The switch is closed because the bait binds to the antibody. The donor fluorophores are always excited, and the acceptor fluorophores are excited, since the distance between donor and acceptor is low. In the presence of creatinine, creatinine binds to the antibody and displaces the bait, opening the switch. As the distance between fluorophores increases, there is no energy transfer from donor to fluorophore, basically turning off the light switch. A laser ensures that the donor fluorophores are constantly excited. And the amount of light that is emitted goes through multiple filters and is then caught by a camera and used to calculate the concentration of creatinine.
Hello from the biosensing team of Twente. Meet AkiSense, a novelty biosensor designed for continuous monitoring of creatinine levels for early detection of acute kidney injury. Our team has engineered this device utilizing advanced electrochemical sensing and aptamer-based technology, resulting in a compact and efficient tool that allows for simple integration into both clinical and post-ICU settings. AkiSense features a user-friendly design with an intuitive and straightforward interface, fit for healthcare professionals to use. This device is able to offer real-time data that can lead to more timely interventions and improve patient outcomes, ultimately lowering healthcare costs. We're excited about the potential of AkiSense in making a real difference in healthcare and look forward to sharing more with you on the translational potential and creativity aspects during our pitches.
Imagine a world where you can monitor your kidney health for just half a cent. This world is real. Let us present you our sensor. Thanks to its high technological colorimetric analysis, a camera, and the usage of microfluidics to boost its precision, our sensor helps you detect creatinine concentration in just a few seconds, the same as you take a selfie.
It is affordable, easy to use, and very versatile. Ideal for those athletes who want to optimize their peak performance. Also, for monitoring creatinine during dialysis process, incorporating our sensor to the whole machine. The whole world can benefit from our technology. Sensing is the future, and the future is Barcelona.
Wow, it always blows me away how creative some of you are. What did you think of the pitches?
Like you said, some were, I think, very informative and some were very creative. I think later in the pitches we'll see even more of those great ideas.
Yeah, and according to one of them, there might be another Steve Jobs in this audience. So, very nice pitch as well. So, onto the program of today. Of course, we now start with the opening, but after that we will have the first round of pitches. And after that we'll have a short break for another round of pitches, the second round. And you can choose different pitches to go to. So there are 4 different places where you can join the pitches. And after that, there will be a partner market where you can walk around. Please do that as well. Try to talk to each other. Try to talk to the partners, to students, to everyone, and have a nice day. And it's also good to stay for the award ceremony.
Yes,
right?
exactly. Because I'm sure you're all very curious now to see who will actually take home the prizes of the SensUs competition. And the award ceremony will reveal it. So
yeah,
make sure to see it.
It's really the moment where you can all enjoy yourselves and take a break for now. So try to be there. All right?
Yeah, there's still a QR code if you want to vote for the Public Inspiration Award. And then I guess we can start to go to the pitch rooms.
Yeah. There will be a few SensUs members who can guide you to the pitching rooms, because Atlas can sometimes be quite a maze, even for students here.